My name is Bryan Jacobs. I'm a prosthodontist here in Chicago, Illinois, and we're here at Dental Professionals of Illinois. When I went to the Planmeca Digital Academy, I think the most remarkable thing about that visit to me versus other visits at vendors was the level of knowledge of the people that were there. We had our Planmeca Sovereign Classic installed about 2 months ago. The learning curve with the Planmeca Sovereign Classic I thought was pretty quick. We had great training at the start for our staff and for the doctors, and so all the basic functions are very intuitive on the touch interface. Our experience with the Sovereign Classic has been phenomenal. Patients walk into our modern treatment center, see it, and they say, I've never seen anything like this before. Now everything I need is right on the chair. We have implant motors, we have electric handpieces, intraoral cameras, intraoral scanners, curing lights, all built right into the unit. Our assistants love it because a lot of the functions help it clean itself. We have more consistent sterilization, we feel like. So the intraoral camera is great because it's built right into the system, syncs with Promexis or your practice management software. Really easy to run, buttons right on it, just like every other modern intraoral camera. We can live view right on the screen and image the patient. They can see it immediately. You don't have to look behind you or at a computer to the side either, which is really great. On the doctor's side of the unit, you have six slots where you can put any combination of different add-ons, from handpieces to lights to cameras to air water. They're literally plug and play. These can come off the unit, pop out, move to a different location, and immediately work. The system recognizes what's in each slot. For us, that plug and play option here, we feel like is a great option that when we're thinking about future of dentistry. We don't know what those tools might be 5 years from now, but we love that Planmeca, being a digital leader, will probably have any of the new tools that we want, and those will be compatible with the system, so we don't necessarily have to rebuild everything, but add on pieces as we need them. One of the great kind of ergonomic features of the Planmeca Sovereign Classic is the knee brake. So for patients that have a difficult time getting into dental chairs or just like to sit in a more kind of chair-like upright position, the knee brake is there, and so their first time in the office, it's not like I'm getting up on this clinical dental chair, but more like sitting in a comfortable regular chair. Our foot control allows us to, of course, control our hand pieces, but there's also a lot of different ways to toggle through modes. So for example, when you're in implant surgery, without having to touch any of the screen or interface, we can switch through your different drill modes, also move the patient around, and so we can keep that aseptic technique as perfect as possible. My assistant loves the suction is not an on-off switch, which is really nice for them for these long appointments to activate it just with light touch. The Planmeca overhead light, I think, even separate from the unit, is the best light out there for dentistry. You can hand activate it, you can also motion activate the light on and off, so you don't have to touch that during kind of a high aseptic or sterile procedure. To my friends and colleagues in dentistry who ask us about, why do we choose the Planmeca Sovereign Classic, I tell them all the benefits that we've seen in terms of having access to all of our equipment right in the unit, the self-cleaning functions, and really that patient wow factor, which is a big part of bringing in new people. They have a chance to see your office, what you've done to keep upgrading it so that you're giving the best patient experience, and I think patients value that.